Today, Department of Health reporting more than 25,000 new cases. So we take a look at the total. That brings our total over 500,000 for the pandemic since it began. And today's numbers include more than 12,000 positive tests that were backlogged in ODH's system. Tonight, we're getting a look at the different testing options, how they are playing a role during this pandemic, and all of the backlog numbers. NBC4's Matthew Herchik joins us now live. We spoke to experts today about PCR tests versus these antigen tests, which are the backlog. So, Matthew, tell me what you learned today about the effectiveness of both of these tests.
Well, Brad, we all know the harsh nasal swab that so many of us have become familiar with over the last several months. Experts say that that is still the gold standard for COVID-19 testing, but that sample could be an antigen test or it could be a PCR test. And experts say while both are effective, one could be considered more reliable than another. As COVID-19 testing increases with the latest wave of new infections, the need for different testing options has become increasingly critical as well.
There still is limitations with testing reagent when it comes to PCR testing. And the most valuable test result is when you get it back really at real time right away.
Which is leading more people to rely on antigen testing to diagnose new infections, a quicker, more cost-effective option.
You get your results back in hours compared to sometimes days for PCR tests.
But medical experts say the quicker results don't necessarily make for more accurate detections.
So the antigen test looks for a different subunit of the virus. They're a little bit less sensitive, a little bit less reliable as well.
Because PCR tests detect viral genetic material, medical experts say they're more highly sensitive, meaning they're more likely to yield an accurate test result.
If there are 100 cases, it will detect almost 100 cases, and very rarely is it a positive because of some other thing that it may be detecting.
But both play an important role in the overwhelming backlog test process.
The PCR test is much better for the spot testing that we're doing if you're only going to get one test to see if you've been exposed.
With antigen tests proving more effective in long-term settings.
Regular testing with an antigen test, whether it be every day or every other day, is very valuable to do.
Again, whether it's a nasal swab, an oral swab, a saliva test, they can all be tested a variety of different ways. It just depends on who's doing the testing and what kind of equipment they're using. So experts said it's really important that people that are being tested, that they're communicating with those that are doing the testing to figure out what exactly that test result could mean for them specifically. Local for you in Columbus, Matthew Herchik, NBC4.